CoolSculpting is one of my favourite treatments here. It's a way to basically get rid of fat without cutting or causing any trauma. When you hit puberty, you will have basically the number of fat cells that you're always going to have. They're not like skin cells and all the other cells in your body that are regenerating and rejuvenating over time. Fat cells you're kind of stuck with. When you put weight on, that fat cell will expand, and when you lose weight, it will shrink, and that's how we basically gain and lose weight. What's fascinating about CoolSculpting is that when we CoolSculpt, we're actually killing off fat cells.
When you come in for your consultation at Light Touch Clinic, you'll sit down with myself or Janine Scott, who's our senior nurse practitioner, and we'll go through the whole CoolSculpting procedure with you. So how it's going to feel, the technology behind it, how you'll feel on the treatment day, the aftermath after CoolSculpting as well, any questions that you want answered about CoolSculpting.
The way CoolSculpting works is that we take that stubborn area of fat, say it was that belly fat over your tummy, and we basically suck it quite tightly into a vacuum, and you're attached to the machine for 35 minutes, and in that 35 minutes we've taken your fat from a normal temperature to a very, very low temperature where it can't survive.
During the CoolSculpting procedure, people are extremely comfortable. The first 6 or 7 minutes you're experiencing a cold tingly sensation that's completely tolerable. It just feels a little bit strange, takes a little bit of getting used to.
After 35 minutes of the treatment, we take the vacuum off and then we start to massage the area vigorously. And that's to try and create as much inflammation as possible in those cells. Then afterwards, people might complain of a little bit of a bruised sensation, but it shouldn't stop them from doing anything. And it's not unusual for that area to be numb for probably up to about 4 or 5 weeks afterwards. And that's because the nerve ending has just slightly drawn away from this extreme cold.
Patients come in on the day and have the treatment, be extremely comfortable, and then the next day they'll head back to the gym, back to work.
Early results of CoolSculpting will happen around about the 6-week mark, and the best result will be at 3 months. And what you should expect is that actually, first of all, that you can feel that there's less fat in the area that's being CoolSculpted.
I had some done on my waist. I always had a small pocket of fat below my bra that always bothered me personally. So having the whole experience done really helped me to believe in the treatment more, seeing results on myself, so I can help guide you through how it feels and the results that I had myself as well.
The ideal patient for CoolSculpting is somebody that's probably within about 2 stone of their ideal weight. They have stubborn areas of fat. They might already be trying to get rid of it with diet and exercise, but for some reason it's not shifting. Advice I'd give for somebody considering CoolSculpting would be choose your clinic carefully, go to a really reputable one, make sure they've had the machine for quite some time so they've got that real body of knowledge. It's surprisingly technical, and if you don't get it right, you won't get the result you want. And call up for a consultation.